Monkeypox cases are rising across the U.S., and experts say it's hitting the LGBTQ community particularly hard.
That's right. New York City is the epicenter of the outbreak in the U.S., with 618 reported cases, according to the CDC. There are nearly 2,000 confirmed cases in the U.S. and more than 13,000 worldwide. Health experts I spoke with emphasize that this outbreak needs to be handled more rigorously, but it's something that's easier said than done.
We're fighting two pandemics at once, and most of our COVID response has been funded by emergency authorization funds from Congress, which they are now no longer authorizing. And so we're funding our monkeypox response based on our dollars here in the city. There isn't federal money coming in for this response.
Kaiser Health News Midwest correspondent Lauren Weber joins us now with more. Lauren, welcome. Thank you so much. You know, we see how city leaders are struggling to keep up with monkeypox, but from the outside, it looks it's a little upsetting because it's not a virus that spreads as easily as COVID, right? It's also a virus for which there already is a vaccine, the necessary tools to fight it. And yet we're seeing all of these cases continue to multiply. So since this isn't a new problem, can you explain how we got to where we are?
Yeah, I think it's important to kind of take a step back and look at the public health system in the United States as a whole. I think we all in the United States kind of expect public health to work like Amazon Prime. We're going to get our packages in 2 days and everything will be fixed. But unfortunately, public health in this country has been underfunded for decades. An analysis we did in 2020 found that 38,000 public health jobs have been lost from the recession to 2019. State and local health departments have lost staff. The sexual health clinics that are actually seeing a lot of these monkeypox patients, their funding from the CDC has been reduced by about 41% if you count inflation since 2003. So, we are seeing a pretty battered safety net to catch these folks and to prevent the spread of this. And I think the ramification of that is that we're seeing a lot more monkeypox.
So against that backdrop, monkeypox testing is expected to be readily available this month, but vaccines are in short supply, so much so that the demand for one caused New York City's vaccine website to crash last week. What needs to happen to help states stay on top of these outbreaks?
The bottom line is states and local health departments are dealing with pretty outdated systems too. We got to talk about that. I talked to officials in Missouri and Florida who are counting monkeypox cases via fax. I mean, this is not, you would think that after we emerge from COVID, we haven't even emerged, we're in the middle of COVID-19, but you would think as we are facing COVID-19 and are fighting a pandemic, that those kind of data infrastructure systems would have been updated, but they're not. So state and local health departments are doing the best they can to get the word out there, to deal with the staff that they have, to get the message out there and to talk to more people and hopefully, catch and contact trace as best they can. But, once again, only 28% of local health departments have an epidemiologist on staff, which is what, an epidemiologist is essentially a disease detective. So it's the person that is supposed to, figure out where the disease could be going. And, like I said, the staffing's not there.
And of course, we're talking about how this slow response to the monkeypox outbreak in the U.S. is really causing the virus to get a head start. But what does this say then about the nation's preparedness for other pandemic threats?
It doesn't say anything good. Most of the public health experts that I speak to are really disheartened, and they believe that, this lack of investment, this lack of attention, even amid COVID-19, surging as it is right now, it is partially leading to the burnout that's driving a lot of professionals from the field. And they worry that, the continual boom bust cycle of funding has only even been accelerated during COVID-19, where we saw, big boosts of temporary funds, but, the workforce funding to fund more folks to work in health departments is only now becoming available, 2.5 years in. And so there's a lot of concern among public health experts that this really just shows how ill-equipped our public health system is to continue dealing not only just with COVID, but with the other infectious diseases that it's charged with protecting us from.
Lauren Weber, thank you so much for your insight into, what medical communities across the U.S. are dealing with right now. We really appreciate it.